Over the past decade, vascular surgery has seen remarkable advancements driven by technological innovations and evolving clinical practices. Traditional surgical methods are being complemented and in some cases replaced by minimally invasive techniques, aiming to reduce patient recovery time and improve long-term outcomes. One of the most significant breakthroughs is the development of endovascular surgery. Unlike traditional open surgery, endovascular procedures involve inserting a catheter through a small incision, usually in the groin, to reach the affected vessels. This technique is widely used to treat conditions such as aneurysms, deep vein thrombosis, and peripheral artery disease. The introduction of drug-eluting stents and balloons has also transformed the landscape. These devices release medication directly into the artery walls, preventing restenosis and enhancing vessel patency. Another notable innovation is the advancement in imaging technologies, such as intravascular ultrasound, IVUS, and optical coherence tomography, OCT. These modalities provide high-resolution images of the blood vessels from the inside out, allowing surgeons to make precise interventions and ensure optimal stent placement. Moreover, the integration of robotic systems in vascular surgery is on the horizon. Robotic-assisted procedures can increase accuracy, minimize human error, and extend the reach of surgeons in complex cases. Artificial intelligence and machine learning algorithms are also being harnessed to predict surgical outcomes and personalized treatment plans based on patient-specific data. Telemedicine has further enhanced the vascular surgery field by enabling remote consultations and follow-ups, thus increasing accessibility to specialists and reducing the need for frequent hospital visits. In addition to these technological advancements, there is an ongoing effort to improve perioperative care. Enhanced recovery after surgery ERAs protocols have been implemented to optimize pre- and postoperative care, focusing on pain management, nutrition, and early mobilization. These multifaceted developments in vascular surgery underscore a shift towards more patient-centric care, with an emphasis on less invasive procedures, precision medicine, and holistic treatment approaches.